Like so many across the world, scientists and non-scientists alike, every nook and cranny of this last year, I think, has been pretty definitively marked by the COVID-19 pandemic and our response to it as a national and a global community. I think that COVID-19 has really illuminated so many of the cracks in our systems, from the ways in which we communicate about emerging research to build trust with non-experts, to the ways in which existing health inequities have been exacerbated in times of crisis like this. And what I have been heartened by in the middle of this pandemic, however, is watching a new sort of paradigm emerge for how we do science, how we engage in conversations around science, and how we think about who it is that science should ultimately serve. Now, I sit in the Office of Strategic Initiatives within the National Library of Medicine, which is one of the 27 institutes and centers at the National Institutes of Health. And as a national library, the heart of our mission is really to ensure that we are providing equitable access to information for a broad range of stakeholders. And that includes researchers, policymakers, clinicians, as well as the non-expert public. And as a national library, that is an integral part of a pandemic response to a novel virus. That role as a library has accelerated dramatically as we keep pace with the growing information that researchers and clinicians are generating as we learn more and more about COVID-19 with each passing day. And the willingness of the scientific community to share information so quickly and so collaboratively has been really, for me, a welcome departure from my experiences in graduate school just a few years ago, when I was privy to a culture of hyper competition and sort of secrecy that wore on me. And from my perch at the National Library of Medicine, I've been able to see scientists engage more in publishing things like preprints or pre-peer-reviewed publications in order to share their advances in real time so that others can verify their results and build on them so that we can be making progress as quickly as possible. And I've also seen a growing interest in sharing data and software tools that are built to analyze COVID-19 data before researchers have even published their results, which led us at the National Library of Medicine to host a workshop in the early months of the pandemic on how researchers might share and discover COVID-19 data and associated tools for data analysis. And I've also seen researchers understanding that with this massive influx of information, that all of this information can be really daunting and difficult to process for both experts and non-experts alike. And so recognizing this, I've seen researchers take to social media and other forms of public communications to help process and sort through our emerging understanding of the novel coronavirus and what that means for our everyday lives. And baked into this increased public engagement is really a recognition among the research community that communicating with non-experts is actually central to our mission of ensuring access to scientific discovery, no matter who you are, no matter what you study, no matter what your background is. Now, of course, I don't want to paint, an overly rosy view of where we are. Inequities persist and have been exacerbated by this pandemic, owing to factors like socioeconomic inequity, racism, and disparate access to care. Despite our increased efforts around collaboration and public engagement, these persist. And we can't ignore that Black and Latinx residents in the United States are 3 times more likely than their white neighbors to become infected by SARS-CoV-2. And twice as likely to die from COVID-19, according to a July investigation by the New York Times. Yet these populations are still underrepresented in COVID-19 clinical trials. And these are all communities in which trust in scientific and medical institutions is low, owing to a history of ethical abuses, as well as a lack of representation within the biomedical workforce that persists today. But these are all things that we have the power to change. And indeed, we're working towards that change, from NIH-led efforts to, for example, partner with communities that have been historically underserved to ensure that they have adequate access to testing, to longer-term commitments to increase diversity and inclusivity among the biomedical workforce. And all of these efforts are really to ensure the brightest future possible.